This lecture is talking a little bit about how one would develop a question for evidence-based practice. This is a little different than our previous lecture, which looked at developing research questions, because here we're really thinking about how we go to the literature and find information about the question that we need to answer so that we can actually change our clinical protocols. Now, why is it important to have a process for doing this? Well, the truth is that there's a tremendous amount of information out there, and you really want to pick out a question that makes sense to pursue. If you have something that's too broad, you can start looking at tremendous volumes of information. If you look at something too narrow, you might not actually find anything that's worth your time. So there actually is a structured process for thinking through how one would go to the literature to find the answer to a question that you're interested in. Now, another element to asking the right question is to ask a question that is actually significant and that makes sense. Now, there's two different types of questions. One are background questions, and these are questions that you can typically find by getting information from, say, textbooks or manuals. This is more general knowledge for the field in which you work. Now, background questions are not actually interesting for evidence-based practice because these are things that are already really established. What you want to find is a foreground question. This is a question that is a novel question that really hasn't been answered yet in a very established way within your field. Now, a way to answer this would be to go directly to the literature and start to assemble literature that addresses your clinical practice question. So what is the process for developing an evidence-based practice question? Well, as we mentioned, you want to develop an overall clinical question. Then we want to go to literature and start finding evidence as it relates to that question. Now, as you go through this process, the significance of the question actually is going to become more and more apparent. You may find that the question that you were originally asking is actually somewhat off. Maybe it's too narrow, or it's already been answered in some way or another, or maybe there's no relationship, so it's actually nothing that's even worth pursuing for your particular interest in the questions that you're interested in. But as you develop this question over time, you're going to hopefully hone in on some specific set of literature. Then you will take that literature and you'll rank that literature for quality and try and come up with an answer as to how to address the clinical practice question that you've asked. And then we can use that information to actually change clinical protocols. So what might evidence-based practice question look like? Well, here's just an example. Do oral antibiotics or treatments enhance healing or are topical dressing sufficient for treatment of leg ulcers in sickle cell disease? All right, so that's just an example. Let's break that down in a way that is a little bit more systematic. So many of you may have actually already heard of the PICO acronym. What it is essentially a systematic process for developing a good, clear, evidence-based practice question. Now, you'd expect it to have 4 different components. The first of which would be the patient population that you're interested in for your question. So that's similar to research population, so teenage mothers, for example, or injured athletes. You also want to talk a little bit about the intervention that you're interested in looking at. And there's a wide range of different types of interventions that would be appropriate for this. Some examples might be a therapeutic intervention. So, for example, wound cleaning strategies to see whether or not which ones are better or worse. It could be something that's preventative. So it could be hand washing, for example. Or it could be something diagnostic. So is a new technology better at, say, detecting early stage colorectal cancer? It could also be organizational. So you might be looking for better strategies for recording health information so that the whole process becomes more efficient. Another element to this is C, or the comparison of interest. So in this case, you're going to be talking about how different interventions different interventions are going to be compared. So it may be that you're comparing 2 different types of interventions. So, for example, say weight reduction pill as compared to exercise for reducing weight. Now, in some cases, you're also going to be doing a comparison between an intervention and, say, standard practice or no intervention at all. And we'll talk a little bit more about that later. The other thing that you really need to think about creating a clear definition of is the outcome that you're actually interested in. By making this very clear, you ensure that you don't go all over the map with the research that you're doing in the literature. All right, let's look at the PICO framework in the context of the real example that we looked at earlier. So what would be the patient population of interest? What would be the intervention of interest? What would be the comparison of interest? And what would be the outcome of interest? So why don't you take this and pause it for a few seconds and see if you can figure that out. All right. So the population, in this case, would be people who have sickle cell disease. So those are the people that we're looking at for this particular question. Now, there's actually two different interventions in the context of this question. One is oral antibiotics or treatments, and the other is topical dressings. All right, and now that sets up us for the next question, which is what is the comparison? Well, the comparison is between the two different interventions. All right, and what is your outcome? Well, your outcome is whether or not taking on these different interventions actually improves healing of these leg ulcers. All right. I'm just going to talk about some additional information that's going to be helpful for thinking about PICO questions. Well, first off, in a PICO question, the PICO components are actually not labeled. So you're just going to write it like a normal statement without specifically saying this is my population, this is my intervention, etc., etc. I would also want to note that quantitative and qualitative PICO questions are actually typically phrased differently. Quantitative questions actually use all the PICO elements, or PIO. Now, when it uses PIO, it's typically in a situation where you're comparing a new intervention to, say, standard practice or no intervention at all. So sometimes researchers will actually not specify that that's the case. For the purposes of class, I actually want you to make it clear what the comparison is, even if you are comparing to standard practice or to no intervention. Qualitative questions are a bit different in that they typically use only the population and the intervention. In this case, the intervention is really going to be a little bit understood broadly more as the situation. So it's going to be some experience that the population you're looking at is going through. Now, it's really important in designing a PICO question to make sure that it's neither too general nor too specific. If it's too general, say you're looking at, health, the influence of some intervention on health, you're going to be looking through so much different literature it's going to drive you insane. So you want to pick a more specific sort of health outcome, say blood pressure. And you can get even more specific than that if you want. Now, on the other side, there's the problem if you get too specific too fast. If you have something that's very narrow, you may not actually find any papers that address the questions that you're interested in, and you have to go and make it broader again. So this is a continual process where you go through figuring out how to state the PICO question in a way that it gets a coherent set of literature that's very clear and bounded and can answer your clinical question. All right, so let's just look at another example. So why don't you take a few seconds and go through this example and try and pull out the components of it. And here's another example. Now you'll notice that this is an example of a qualitative PICO question. So in conclusion, remember that the PICO framework is a process. It's essentially a tool for you to use to try and help make evidence-based practice questions that are efficient in guiding you towards a coherent set of literature. By answering the components of each of these components to a PICO question, it helps you really create a clear frame of what types of things you want to look at. And that's going to require a process of doing a lot of reading in the topic area that you're interested in. And as you go through this course, you're going to refine it more and more. You're going to make it either more specific or more broad depending on what you see in the literature. And that's okay. That's part of any sort of evidence-based practice process. The more you think carefully about the PICO components, though, the faster you're going to be able to narrow in on the question that you will address as you go through this term.